Hello, Amber here from Love Fit. I want to talk today about diastasis, something I've spoken about lots of times before. I've blogged about, written, spoken, all sorts of different offerings, and yet the thing I feel people maybe have the least education around. And having just got back from conference at the weekend, Borough Education Women on Fire weekend, this is kind of all back in my mind, and some of the stuff that came out at the conference is also stuff that I recognise in my daily work and the kind of questions I'm getting asked by clients all the time. So this is something I could talk about. Literally, I could sit and do like a 2-hour long seminar on, maybe something to actually arrange in the future, but right now I just want to hit through a few important points. So firstly, diastasis, what is it? I think most of you watching this are now aware. Diastasis is a separation of the rectus muscles, so your six-pack muscles. It's when there is a separation. Now, what that does not mean is that the muscles have literally ripped apart, as people often like to bandy around. That's not really true. It's the connective tissue down the middle, so the linea alba. It's where that connective tissue has kind of just stretched and become thinner. If you kind of think of like cling film or a pair of leggings or something, if they get really stretched, they become kind of see-through. And some, like with swimming costumes, it sometimes happens. It loses its elasticity and just becomes thin and therefore less supportive. That's really what's happening. So your diastasis recti is where that connective tissue has stretched out. Now, most commonly we think about this in terms of pregnancy and postnatal period. Everybody's tummy, to an extent, has a diastasis. You cannot grow a baby and expect your tummy to expand enough to accommodate 9 months of baby growth without those muscles separating. Post-baby, the muscles move back towards the midline. In some cases, not that many, but in some cases, by sort of 6-8 weeks, when you're having a GP check and thinking about getting back to some proper movement, those muscles might pretty much be sitting back together and feeling really strong. In many more cases, there is still a degree of separation. How severe that separation is, and we usually measure it in terms of fingers, so how many fingers can you get into the gap, is then more of a question about, how severe is that diastasis. But the size of the gap is not the be-all and end-all ever. And also, you can have a diastasis without having had a baby. Sometimes very obese people have it because of just expansion of tummy. The beer gut that some men have, they have a diastasis because that tummy is rock hard and has moved forward. Some weightlifters, men and women, but women without children, just from very extreme pressure and kind of pushing out on those tummy muscles. So while we think about it as a post-baby thing, it's not exclusive to that. But in terms of this talk today, I'm mainly aiming this at those women. So that's what diastasis is. The question I get asked the most is, what exercise can I do to help close my tummy gap? When will my tummy gap close? That kind of thing. Now, as a movement specialist, as somebody who takes money off many of you watching this to show you how to move, this might sound like a really daft thing for me to say, but exercise per se is kind of way down the priority list in terms of healing a diastasis. Now, I'm not saying you shouldn't be doing exercise. I'm not saying don't come to my classes, because the classes I teach, particularly in relation to postnatal, so my tummy time class on a Wednesday, very much focuses on breath, on restoring function. But when people are asking me what they should do outside of class, there are so many other things that should come before worrying about what particular exercise to do. So I'm going to come back to them in a minute. But firstly, also I think we just need to have a bit more conversation around when to be concerned, when not to be concerned about a diastasis. So I think it's really good that actually in the media and, if you scroll through social media, lots of people are more aware now about diastasis. I think even just going back like a year, but certainly 3, 4, 5 years, people barely knew that it was a thing. People were doing very inappropriate exercises. People weren't really given information and support about what a diastasis was and how to aid healing. And now there's a lot more talk about it. There's lots of celebs talking about it. There's loads of online programs. You know, I'm always getting in my newsfeed on social media, oh, how I fixed my abs, how to heal my diastasis, etc. There's lots more information, which is great, but it's almost gone a bit too far the other way, in my opinion. I think there's, you know, what I'm saying is that it's possible to get too obsessed with the gap. You know, it's perfectly normal and perfectly possible to have a gap between your tummy muscles and that not be a big issue. So when is it not an issue? It is not an issue if that gap is, you know, relatively small. You know, if we're talking sort of 2 fingers or less, so 2 fingers is still, you know, a reasonable amount, but if that gap is not too large, that your connective tissue generally, especially up here and below the belly button, if that connective tissue is good and firm, responding properly, if the abs are functioning as they should, nobody's got too much sort of gripping and tension in their abs in the wrong places, and also if you are symptom free, so you're not leaking, you are not having any pain in your pelvis, you haven't got lower back pain, you don't feel like your pelvic floor is loose and unsupportive. If you don't have any symptoms, you just literally do just have a bit of a gap, then really, I honestly, I'm not saying just ignore it and go out and do loads of crunches and things necessarily, but let's not get obsessed with it. Let's not make that the focus of everything in our lives. I think as a mum, especially a new mum, you have way more things to be worried about than whether you can get one finger around your belly button. You know, that if there's nothing else going on, then as long as you're continuing to use good breath techniques when you're lifting your baby, getting out of bed, not doing anything, you know, extreme or foolish, then don't worry about it. When is it a problem? It's a problem if you are having any of those symptoms I just mentioned. So if you do feel like you are unsupportive, if your back hurts a lot when you're trying to lift up your baby, if you're managing baby and toddler or, you know, several children, and you're finding that your back feels sore, that your pelvic floor does not feel good, if you're leaking when you sneeze, cough, move, any of these things, then quite possibly if there is a significant diastasis, that is part of the problem. Almost certainly it's going to be part of the problem. And also from a psychological point of view, if you have a very domed tummy, that, you know, and where some people say, oh, I feel like I still look pregnant, then that, you know, that is an issue. Even if your function's good, it's an issue if you are feeling aware of it. Of course it is. And the reason that you know, we get the, and I'm using these terms that other people use, but the mummy tummy, the pooch, that rounding of the belly, is because where those, the rectus muscles are now sitting sort of apart from each other, they're kind of relaxed here and everything's just pushing forward, okay? So instead of sitting flat, they're pulled apart slightly and you get that rounding instead of this pulled in flatness, okay? So in terms of actually healing it, and sorry, this video is already longer than I wanted it to be. As I say, there's so much to talk about here, but in terms of actually healing it, the first thing you have to do is look at your nutrition. Are you hydrated? Are you getting plenty of protein? Those 2 things, water, protein, are absolutely the first thing you need to address, because this connective tissue that is currently suffering, that is stretched, that is weakened, is largely made up of collagen. Collagen is water, amino acids, so you've got to get hydration, you've got to have protein. Those are going to be the building blocks of repairing your connective tissue. Okay, so that's number 1, look at your nutrition. Number 2, and this is a really tricky one for mums, but it's adequate rest as well. If your body has birthed, even if we're talking 6 months down the line, a year down the line, several years down the line, if you're not supporting your body with adequate rest, then it's really hard for your body to heal. So sometimes that is unavoidable, but anything you can do to help that, whether it's booking yourself in for a massage, if it's being able to get to bed a bit earlier, any of those things, if you can make them work, please do. Thirdly, coming back to massage, see a soft tissue therapist, because there can often be a lot more going on than just, oh, my tummy muscles are not sitting apart. There's often more going on there. So maybe your pelvis is slightly out of alignment and something is pulling on these muscles. Quite often in postnatal women, we see very overactive obliques, so these muscles here, and if they're too switched on, they essentially are pulling. These are the muscles that help you rotate externally. So if they're pulling, they're actually pulling that diastasis further apart, okay? So get somebody to lay hands on you. Go and see a massage therapist, especially somebody who specialises in pre and postnatal. See a women's health physio. She can check all of these things. If you had a C-section, you do need some work done on your scar. So soft tissue therapist is the next one. And then also, really important, breathing strategies, proper breathing strategies. Now, I do have on my YouTube channel in the postnatal series a video on how to breathe properly, and I'm not going to go into that in huge detail now, but making sure we have proper, full, expansive breaths, making complete use of this abdominal cavity. If we just breathe up here really shallow, or if we're breathing constantly into our belly, which a lot of women do, if you're with every breath expanding into that belly that's already weakened, we're just pushing on that diastasis more and more. So we want to make sure our ribs are moving. You know, a lot of postnatal women really rib fix. It's really common. So again, working on your breath, learning to breathe into your hands, expand the ribs, and then exhale and pull everything down with that little engagement of the pelvic floor on the exhalation. All of that is going to help get your breathing mechanism working. And when your breathing is good, I've just posted a video today on my Facebook page, my Love Fit Facebook page, about how much your pelvic organs and all of your organs here move with every breath. So if you watch that video, you'll get an idea of why it's so important to make sure your breathing is correct. Okay, so nutrition and hydration, adequate rest, see a soft tissue therapist, and get your breathing sorted. Those things are going to pay huge dividends, okay? Huge dividends. We layer the exercise on top of that once we've kind of corrected things, and we build the exercise up gradually so that you're not doing too much to a body that's destabilized in the early stages. Okay, I've already spoken for way longer than this video is supposed to be, and I've barely touched the tip of the iceberg. So I think I am going to organise a seminar that people can watch on this, just for a small fee that people can then come and have a look at, and I'll go into this in a lot more detail, but I think it's really important. So yes, the mummy tummy is not necessarily an issue, but if it is, just because of aesthetics for you or because of function, then yes, there are things you need to do, and you need to address those 4 points as your kind of starting point before we worry about anything else. Okay, ladies, if you have a gap and it's small and it's not causing you any problems, let's look at the bigger picture. You know, let's enjoy moving. Let's get ourselves strong and supportive for looking after our kids. And yeah, shout if you have any questions, and I will see you on my next video. Okay, take care. Thank you for listening. Bye.